Attunement and responsiveness. Attunement and responsiveness serve as foundational components in the therapeutic alliance, embodying the dynamic interplay between therapist and client that is essential for effective collaboration and healing. This intricate dance requires a deep understanding of both the explicit and nuanced aspects of human interaction, extending beyond mere empathy to encompass a sophisticated attunement to the client's cognitive, emotional, and somatic experiences. The therapist's capacity to finely tune into these dimensions and respond with precision not only facilitates a supportive environment, but also engenders a transformative space where the client feels truly seen and understood. The theoretical underpinnings of attunement and responsiveness are rooted in attachment theory, which posits that early relationships with caregivers shape an individual's ability to form and maintain relationships throughout life. Secure attachment is cultivated through a caregiver's consistent attunement and responsiveness to the child's needs, laying a blueprint for future interpersonal dynamics. In the therapeutic context, these principles are mirrored in the therapist's role, wherein the practitioner acts as a secure base, fostering a reparative experience for the client. This process hinges on the therapist's ability to detect subtle cues, both verbal and nonverbal, and to respond adaptively, thereby reinforcing the client's sense of safety and trust. End. Advanced insights into the mechanisms of attunement and responsiveness reveal the complexity of these processes. Contemporary research underscores the role of mirror neurons, which facilitate empathy by allowing individuals to internally simulate the emotional states of others. This neural mirroring is instrumental in the therapist's capacity to resonate with the client's affective and cognitive experiences. Furthermore, the concept of mentalization, or the ability to understand and interpret one's own and others' mental states, enhances a therapist's attunement by providing a framework for reflective functioning. Through mentalization, therapists can maintain a mindful awareness of their internal states while attending to the client's, allowing for a balanced and responsive therapeutic interaction. From a practical standpoint, therapists can employ several strategies to cultivate attunement and responsiveness. Mindful presence is paramount. Therapists must engage in active, non-judgmental listening, attuning to the client's narrative and underlying emotions. This involves maintaining an open and curious stance, avoiding premature interpretations or interventions. Reflective listening techniques, such as paraphrasing and summarizing, can aid in clarifying the client's perspective and demonstrating understanding. Moreover, sensitivity to nonverbal communication, such as body language, facial expressions, and tone of voice, is crucial in capturing the full spectrum of the client's experience. Despite the consensus on the importance of attunement, competing perspectives provide a rich terrain for exploration. The humanistic approach emphasizes the therapist's authentic presence and unconditional positive regard as central to attunement, while cognitive behavioral frameworks prioritize the identification and modification of maladaptive thought patterns, while the former underscores the relational and experiential dimensions. The latter focuses on cognitive restructuring as a pathway to change. Integrating these perspectives requires a nuanced appreciation of their respective contributions and limitations. A relational approach that incorporates cognitive techniques may offer a comprehensive model that addresses both the affective and cognitive dimensions of the client's experience. The integration of emerging frameworks further enriches the discourse on attunement and responsiveness. Emotionally focused therapy provides a compelling model that emphasizes the role of emotion in the therapeutic process, positing that attunement to the client's emotional experience is key to fostering change. EFT therapists aim to identify and transform maladaptive emotional responses, facilitating new patterns of interaction. This approach exemplifies the synthesis of attunement and responsiveness, as therapists are required to be fully present to the client's emotional world while guiding them toward adaptive change. Pause. Case studies provide powerful illustrations of attunement in action. Consider a scenario in which a therapist is working with a client who presents with symptoms of complex trauma. The client's narrative is fragmented, interspersed with intense affective states that oscillate between hyperarousal and dissociation. Here, the therapist's attunement is manifested in their ability to regulate the emotional climate of the session, pacing interventions in accordance with the client's window of tolerance. By attuning to the client's somatic cues, such as changes in breath or muscle tension, the therapist can adjust their approach, providing grounding techniques when arousal levels spike or gentle inquiry when dissociation occurs. This responsive attunement not only stabilizes the client, but also fosters a reparative relational experience. In a different context, consider a therapist working with a couple experiencing recurrent conflict due to perceived emotional distance. Through attunement, the therapist identifies underlying attachment insecurities that fuel the cycle of disconnection. By validating each partner's emotional reality and facilitating vulnerability, the therapist creates a space for mutual responsiveness, enabling the couple to reconnect on an emotional level. This case highlights the transformative potential of attunement, not only in individual therapy, but also in relational dynamics, where responsiveness acts as a bridge across emotional divides. The interdisciplinary nature of attunement and responsiveness further underscores their significance. In educational settings, teachers who demonstrate attunement to students' needs create inclusive and supportive learning environments, enhancing academic engagement and socio-emotional development. Similarly, in healthcare, practitioners who are attuned to patients' experiences are better equipped to deliver patient-centered care, improving treatment adherence and health outcomes. These examples illustrate the wide-ranging applicability of attunement across diverse contexts, underscoring its role as a universal principle of effective human interaction. In conclusion, attunement and responsiveness are integral to the therapeutic alliance, demanding a sophisticated interplay of empathy, mentalization, and adaptive intervention. By weaving these threads into the fabric of the therapeutic process, therapists create a dynamic space where healing and transformation can occur. As the field continues to evolve, the integration of emerging frameworks and interdisciplinary insights will undoubtedly enrich our understanding of these complex phenomena, guiding the development of more effective and nuanced therapeutic practices.